we've touched upon this before, so the basic steps of skincare, such as exfoliation and cleansing your face with water. But this time, I think people want to know a bit more in depth about each of the steps. So, as you said, the first step should always be cleaning your face.
Yes. The first step should always be cleansing. That cleansing, the cleanser should be according to your skin type. We've discussed the types of skins. Then after cleansing, once or twice a week, you can use a scrub for exfoliation. For that, I mainly ask my patients to use a mechanical exfoliator. So like you have in the markets, but it should not have too many of chemical ingredients in it. So every time using AHA and BHA will, they will inflame your skin. You need to calm down. Use exfoliation.
You need to take care of your skin as if you actually love it.
Yes. So you need not exfoliate every time, every day. You need to do that once or maximum twice a week. Then every day after cleansing your face, you need to hydrate the skin, moisturize it, and you need to vitaminize in many cases. For that, you need to take care of the barrier function of the skin so that your skin is healthy. You need not go into the sensitive region. So you need to take care of your skin so that it is healthy. Then put on the sun protection factor, which is SPF. Then you are ready for the day.
And you're ready for the day.
Yeah.
You mentioned a bit about improving the barrier function of the skin. I would like to touch on that a little more, because we all know it's all the hype these days, because everybody wants to have collagen and ceramides and this and that. How does the barrier function of the skin actually work?
So you see, of many functions of the skin, one of the most important is barrier function. What barrier means? Skin is a barrier between the outer microbes.
Sorry, but the barrier function remains the same for dry and oily both skins, right?
Of course, yes. Barrier function is something for a healthy skin. So whenever you have some problem with the skin, you have breakouts, you have immense pigmentation, allergies, itching, flakiness, redness, it means the barrier function is compromised.
Okay.
So this is a layman's way of finding out whether my barrier function is okay or not.
So is barrier function just a fancy way of saying the sensitive skin?
Yes. So in sensitive skin, always the barrier function is compromised. So barrier means there is a barrier between the outer environment. There are microbes, there are pollutants, there are allergens, and the inner environment of your skin. So if your skin is able to tolerate everything, it is not sensitive, it has a lot of, it can tolerate many things, then the barrier function is okay. Now, to understand it, let us imagine a wall being built by bricks. Okay, so these bricks are actually the skin cells. So layer by layer, there are bricks, there are corneocytes, your outermost skin cells. And then around the corneocytes, around the bricks, you have that masala, that, cement and all. So that masala or the cement actually has the ceramides and lipids and other things in it, which take care of the corneocytes, which take care of the bricks.
Which make sure that the wall does not fall down.
Exactly.
And once the wall falls down, you have sensitive skin. And you need to strive to achieve what you had before.
Yes, exactly. So I believe I'm able to give you this message that barrier function is one of the most important functions. And to repair that, we need certain compounds which help you. So ceramides and hyaluronic acid is one of them. So barrier function repair cream is very helpful that way, and it should be applied by almost everyone.